Mother's Day is May 12th. We want to give you a jump start on everything from improving your health to gifts and creative time with your kids. So it's all about moms today. This is my mom when either my older sister was a baby or is that me? I can't tell. Anyway, I remember my mom saying, "You just wait until you have kids one day." I had my son. Now I know what she meant. And now I tell my son, don't be in a hurry, but you just wait until you have kids one day. As the saying goes, if mama's not happy, then nobody's happy. If mama's not healthy, the whole family can feel the impact of that too. From tween and teen years to childbirth, menopause, and settling into your senior years, a woman's body goes through a lot of hormonal and physical changes. Our first guest has experienced a lot of it firsthand, and as an OBGYN, she's dedicated her practice to wellness, aesthetics, and functional medicine. In other words, she can help you feel good and look good from the inside out. From finally dropping that stubborn weight to minimizing the symptoms of menopause, Dr. Drshelenalaljiesthetics, also known as Dr. Shel, joins us along with two of her patients, mom and daughter, Paige and Cayman Kincaid. They both went to Dr. Shel Wellness and Aesthetics Center to figure out what was wrong and made it right.
There
All right.
you go.
Good morning.
Good morning,
okay.
Deborah.
Let me start off with Dr. Shel. You discovered a lot of what you know through your own personal journey,
Absolutely.
but also listening to your patients,
Yes.
especially those patients who, through different parts of life, after childbirth, whatever, would come in and say, "I feel," and then one day you felt the same thing.
Exactly. When I have two children, Zoe and Zaid. When I had my second child, all the postpartum things came on, right? We're talking insomnia.
Oh, there they are.
There they are.
Yeah.
So that's Zaid and Zoe, my
Yeah.
little angel. Zoe's about to graduate, so go Longhorns.
Yeah.
And you start feeling the fatigue, the weight gain, the insomnia, the depression, all of that. You just can't, the hair loss, all of that came up, and I said, I got to do something about this.
Yeah. Wait, you have an amen corner right here,
Yeah,
because
yeah.
we've got, you got Paige and Cayman are both like nodding their head, and let me
exactly.
nod my head for you too, because I had the
my
same
gosh,
thing, and you're like, maybe it's
exactly.
just because I had a baby, and
Yes.
things are crazy, and the
Yes.
schedule's off and the whole
Yeah,
bit, but then
yeah.
it kept lasting.
It kept lasting, and that's the thing. You need your doctors to get to the root cause of what's going on.
Yeah.
You don't let people tell you it's all in your head, it's going to pass, or give you just a prescription of a sleep aid or an antidepressant. They need to look at the root cause.
Yeah.
Is it your thyroid? Is it your adrenals? Is it your hormonal balance?
Yeah,
Is
I
it
know
your
from my
nutrition?
story and dealing with
Yes.
you, it was like, I
Exactly.
didn't understand. I went to 5 other doctors,
Yes.
and they were like, okay, you feel a little depressed. It's
Yeah.
because of your thyroid, so we'll give you some antidepressant medication. I'm like, well, wait, if it's
Wait.
because of my thyroid,
Right.
don't replace it with Prozac, replace it with thyroid. Yeah.
With the natural thyroid, and that's something that is so underdiagnosed and misdiagnosed.
Yeah.
So we really need to look at that first.
One of the other problems was that stubborn weight. My son
Yes.
was 9 pounds, 5 ounces.
Oh, my
okay, so
world.
he was big, but
Yeah.
why was 29 pounds, 5 ounces sticking around? Like, what's up with
Yeah.
that, right? But I couldn't lose the weight, and it was so hard. We have a new group of weight loss medications
Yes.
today that
Yes.
everyone is talking about.
Everybody.
That's getting great results. And so
Yes.
the active ingredient is semaglutide.
Yes.
A lot of people are taking it and using it, but not every medical professional may be trained in how to use that.
Exactly. So the new class of drugs are the GLP-1 agonists, or glucagon-like peptide. And the great thing, I like so many things about this, but the great thing is it works with your body.
Yeah.
And it, because this is what we do inside our bodies. We need to release more insulin. We need to, with this drug, you're slowing the gastric emptying so you're able to absorb more of the nutrients. The hunger is lessened. And what's really important is we can, with this drug, try to reduce and decrease the epidemic of the diabetes that we've got.
Well, and I'm insulin resistant, like right on the door of
Exactly.
diabetes, and
Yes.
your whole goal is to stop you from becoming
Stop
diabetic.
you from becoming
Yeah.
a diabetic, and this drug can do that
Yeah.
if used with the right provider, under the right supervision.
And you say right provider. I've heard people say, yeah, I was taking it and nothing happened. I didn't lose any weight. They're probably undertreated.
Yes.
Others are like, well, I was getting sick. That's because maybe they're overtreated. They need to titrate. And that's the advantage of going to, like what you use is a compounding pharmacy that can give you the dose that you need to work with
That's
to begin
exactly
with.
right. So we use Strive Compounding Pharmacy for a specific reason. They go above and beyond in safety, in efficacy, as well as they go with the regulations. And that's really important. The sourcing has to be right, as well as you want to make sure that when they're adding some ingredients like B12, they're adding certain ingredients to decrease the side effects and improve the efficacy. And that's what Strive Compounding pharmacy does.
All right. When someone comes in to talk to you, the very first thing you want to do is, first of all, you listen to what their symptoms
Absolutely,
are. But
yes.
you get labs. I can't tell you how many friends of mine are like, yeah, no, they just gave me the, whatever. And I'm like, do they really know what your issue is? But you get the labs.
Absolutely. But you got to get the history and the labs. And, like Paige and Cayman will tell you, it's really important to know what got you here to begin with. And do you have insulin resistance? What's your hemoglobin A1C? What's your lipid profile? What's your liver, kidneys, blood count? What is all of that doing?
Even what your diet is.
And your thyroid and your
thyroid,
diet. So you need some health coaching. And so that's why don't try to do a flash sale with your health. Yes, there are flash sales. You'll see it all over the internet. But you've got to take your health seriously. And if you do, you've got to go to the right medical provider.
And Paige, you had to take your health seriously because it's your health, number one. But you're a very busy mom. You're a mom and a grandmom. You've had 3 kids as well. One of them sitting next to you. But you have a demanding career, and you can't stay on top of that if you aren't feeling well.
Exactly. So I have been seeing Dr. Shel for about 10 years, and she's been phenomenal. And I had surgeries, and some of those things also I think contributed to my health. And I went in, we did a consult, and she's just been fabulous and got all the, like you said, the labs, made sure, like, where are you and what do we need to do? But I think one of the, where I am now in my health journey is just feeling phenomenal because of just having a dinner with a good friend, and her saying, and me just saying, hey, I'm going on this trip to Africa, and I've been struggling. I feel exhausted all the time. I can't lose any weight, and I know that I've gained weight since COVID. Like, I put on quite a bit of weight during COVID.
You lost about close to 40 pounds
Yes,
now?
yes.
Wow.
Yes.
Okay.
So, and I think that she was like, well, let's come in next week, and I'll talk to you, and we'll do some labs, and I have something that I think may help you. And I went in, and it was so easy. Started on like the semaglutide, and we did the titrate up, and just continued with the health coaching, went in every week. And just, you get to learn the staff, and then also on top of that did infusion therapies. B12 shots were huge in addition, because for me, like a little bit, like the first week was a little difficult, but not bad, just like you definitely feel a little different, right?
It's your body riding the ship.
Yes, exactly.
Right?
You're getting used to it.
You're used to eating, whatever you're eating and your meals and stuff. So you do have to learn a little bit about, okay, now I'm starting to feel like really full, so just not overdoing it.
Right.
And then once you get used to it, that first week, that was it. I was great. I did hear people that did do it, and after that first week, they were like, I didn't want to keep trying it.
And a lot of them too, I tell you, I have a group of friends, they didn't have the doctor to call back and say, okay, here's what's happening now. What do I do? And it's like, oh, I don't understand. It's working for other people. Okay, loser. It's like, no.
It's all in the coaching.
Because our bodies are all different too. How we're going to
customization and compounding, that's where it is.
I like what you said, over the last 10 years, we go through different stages of life. So it's a maintenance program. There are times, just like when you get your physical, this is a more specific physical, if you will. We come in and say, something's changed, something's shifted, right?
Yes.
All right. Cayman, okay, first of all, you're the mom of 3 beautiful little kids, right?
3 little ones, all under the age of 6.
Oh, bless you.
Yes.
Yeah. All right, so you were going through some things in postpartum as well. And so what types of feelings were you having that you just thought, I have to go see somebody?
Just a lot of brain fog and just feeling really sluggish. And I had 2 babies. They're 15. My younger 2 are 15 months apart, so really close together. And so after my 3rd, I was really just feeling like really just not myself. And I talked to my mom a little bit, and she's like, you really should try and go get a consult with Dr. Shel. And I, the same amount of time, I've seen Dr. Shel for over 10 years through my time in university, even when I was, living out of state. And so really, I'd come back to her and I said, I'm really just not feeling.
You have Hashimoto's, which is a thyroid condition, which can stop you from losing weight.
That's right.
Also make you depressed, make you tired, all those things. But you've lost a considerable amount of weight since then by addressing that as well.
Hair loss, all of the things. Or I just like, I'm just
things,
not feeling myself, and I don't feel like I can be the best version of me. Like, what's going on, right? And how do I kind of, where does my health journey need to go to feel better and to be better and to be there how I want to be there for my kiddos and my family. And so that's like why we, she told me about semaglutide, and I was just like, oh my gosh, yes.
Semaglutide the right way.
Yes,
Okay,
yes,
so there's that
exactly.
whole point of feeling good, as I mentioned, on the inside, but there's
Yes.
also the outside. You have a
Absolutely.
number of
Right.
things where people don't want invasive treatments and surgery.
Sure.
Let's kind of run
Sure.
through these real quick.
Yeah.
M-Sculpt, which helps you to build the core and rid of visceral fat.
Yes. So what happens with semaglutide, Ozempic, et cetera, there's actually something called an Ozempic butt and an Ozempic face. So, an Ozempic body. So if you look, M-Sculpt Neo uses two different technologies, high fem technology and radiofrequency to reduce fat, and it also addresses visceral fat as well as build muscle.
Yeah.
So with a single treatment, you are losing fat and building muscle in a 30-minute treatment, 4 treatments, and you really have 30% reduction of fat.
Yeah, all right.
Yeah.
M-Tone, what do you know that gets rid of cellulite?
Oh my gosh, so cellulite is very tough, we know this, but M-Tone uses two different technologies, again, radio frequency as well as some mechanical stimulation to break up that cellulite. And when you look at the screen right now, you're seeing the buttocks right there where you're getting rid of some of the fat, building muscle, but also smoothing out the skin. And that's what you want to do when you combine therapies. And for us, it's all about combination and customization.
Yeah.
So you want to use the best therapies out there to build muscle, get rid of fat. If you look at the abdomen, you're getting rid of that visceral fat in the upper belly, and you're smoothing out the skin and tightening the skin.
Yeah,
because
Exilis
that'll
also is
happen.
tightening and toning.
Exilis will tighten and tone the skin with different technologies combined together, ultrasound, radio frequency. All of these combined treatments are really important because single things can't do it.
Yeah.
And that's why it's really important to, as physicians, have the appropriate therapies and technologies in our offices, but also be able to combine them and customize them. Like
Yeah.
Paige has had the M-Sculpt Neo and has had
Yes.
great experiences.
And it's so comfortable. You just put the TV on, turn the lights out, and you feel like you've just done this amazing workout, and you feel great. And literally, when you get up, you can tell, like,
Yes.
Yeah,
It's-
it does
it's
the workout
incredible.
for you,
Oh, yes.
for the equivalent of like
And you-
a kabillion
yeah.
crunches,
Yeah.
right?
Yeah,
20,000
it tones and
crunches.
tightens,
Yeah.
incredible.
Which you
Yes.
could not
Yes.
do on your own.
Yeah.
You could not, there's no way you
Yeah.
can do 20,000 crunches,
Yeah.
right? No, absolutely
You
not.
just be crunching all day long.
Yes, yes.
Okay, urinary incontinence and sexual health issues. Both of those can happen, especially after childbirth.
Absolutely.
I remember going to the jumpy thing with my
Yeah, you
friends and my
just-
son, and we're all jumping, and my friend goes, "I can't jump.
I
I
know.
can't. I gotta get off. I gotta get off."
Well,
So-
90% of women have some form of incontinence and sexual health intimacy issues, and only 60% of them ever talk about it. So you think about how many women, millions of women and men are suffering with this in silence. And so my mission has always been, you ask the questions and you bring forth the non-invasive treatments because people don't want surgery. Most people don't.
and a lot of times surgery is not the answer for this. It doesn't work for these things.
Exactly. So with Emsella, you're doing about 11,000 Kegel exercises in a 30-minute
If I told you I was doing mine right now.
I believe you. I believe you, but I was saying, let's do 11,000.
Yeah, let's do 11. Yeah, I can't do 11,000.
Exactly.
Okay.
So it stimulates the pelvic floor muscles. So the intimacy is better. Your incontinence, whether it's urinary incontinence with stress or urge incontinence, all of it improves. And even if you're running in the middle of the night to go to the bathroom 4 times a night, you're not going to get sleep. You're going to gain weight. You're going to feel horrible. You're going to be sluggish. So, the message is we've got menopausal women like me and Paige. We've got, postpartum young women who are trying to be themselves, live their best lives.
Yeah.
But we have things that we need to address and have customization to that.
When you did that with me, you helped me to glide through menopause. I didn't,
Yes.
people were having hot flashes and crazy. I was like, menopause is fine with me. Like, shut up, right?
There you go.
MFem 360, dryness and laxity.
Dryness and laxity, and again, when you talk about intimacy issues, it's a real thing. You've got, you're married, you have partners, what have you. You want to, it's all about confidence, right? Women need the confidence and the ability to go through life confidently and to be able to be satisfied.
Core to floor therapy, but there's also things like lifting the face, and, getting more collagen production as we
Yes.
lose collagen as we get older. So old therapy for Fotona 4D non-surgical facelift as well.
Those are really important for the face. If you look on the screen, when you lose weight or when you go through menopause or just aging, you're going to get laxity on your face. You're going to lose collagen. So we want to do treatments like all therapy, like Fotona 4D, to actually stimulate the collagen and really lift the skin naturally.
Yeah, all right. You also have, fillers, Botox, face filler, all that type of stuff.
Exactly,
and you are
but
an
naturally,
OBGYN. Yeah,
non-invasively.
Yeah.
Yes.
All right, ladies, thank you very much, and
Of
happy Mother's Day.
course.
to
Happy
all of
Mother's Day.
you.
So good to be here. Thank you so much.
Dr. Shel has these special offers for Great Day viewers. Starting with the first 25 callers will receive 30% off 3 months of a semaglutide or tirzepatide package, along with free Slim Shots.
Yay.
Second, you can get 25% off any aesthetic or wellness package, or you can receive 1 free month of semaglutide with the purchase of the Core to Floor package. To take advantage of these incredible savings and start living your best life, schedule an appointment and learn more about all of Dr. Shel's services online at drshel.com. You can also give their office a call right now, 281-313-7435. Again, that number is 281-313-7435. Maybe a good Mother's Day gift there. Okay.